Welcome to Inspire West Michigan, the podcast that celebrates the visionaries, change makers, and business leaders shaping our region. Whether you're a fellow entrepreneur, emerging leader, or curious community member, Inspire West Michigan delivers content that informs, uplifts, and empowers. In each episode, we'll go behind the scenes with local CEOs, presidents, and entrepreneurs to uncover the stories, strategies, and values that drive their success and inspire our communities. From Grand Haven to Grand Rapids and beyond, this is Inspire West Michigan. Let's dig in. On today's episode of Inspire West Michigan, I'll be talking to John Foss, Senior Vice President of Operations for Trinity Health Grand Haven and Shelby. We'll hear about how John's decision to join the Army fresh out of high school set him on a path to becoming a licensed physician's assistant and now running 2 rural healthcare systems. He made so many stops along the way, and I can't wait for you to hear more from John. Thanks for joining me, John.
Thanks for having me.
Yeah, I had so much fun talking to you the other day, and I felt like I walked away learning a ton, so I'm excited to talk more and have you share all of your experiences. Okay, so let's go back to when you were in high school. Like the rest of us, you felt like you wanted to do something after high school, but you weren't sure quite what. How did the decision to join the Army come about?
Yeah, so I think like any high school kid, you get done with that, I'm going to graduate, you realize that's going to happen, and then what's next? A lot of my friends going to college. Had a few people in my family go to college, but that really wasn't a roadmap that was easily laid out for me. And, my mom stayed home when I grew up. My dad worked on the railroad, and, they did well. We had a great childhood, but I felt like I needed to sort of support myself through college. I needed to have some skin in the game in order for me to take it serious, and I didn't know what I wanted to do yet. So before wasting money on tuition and room and board and books, and I didn't know what I wanted to do, I thought, well, my dad was a Marine. My grandfather was a Marine. I had uncles in Navy, Army, Air Force. So there was a little military background. I decided to go down and talk to the recruiter. The Marines didn't have any college fund money at the time. Yeah. So I knew that was sort of off the board, but the Army did. And it was back when they had the big video discs that they'd put in the machine. Yeah. And they had 2 jobs that I thought I knew I was qualified for because you take the ASVAB.
Sure.
And one was a combat medic, and then the other was counterintelligence. So they send you to a MEPS station to get your physical, and you pass that, and then you sign up for your job. They didn't have a counterintelligence slot open at the time. A lot of people were trying to get in there, get signed up so they get the cash for college when they were done, the college fund. So I chose combat medic, and I was off to the races. I'd never been on an airplane before. I got my first airplane ride out of the deal.
Yeah, I have so many questions about that because, as a high school kid, do you even know what those options are, what it means, what the next few years are going to look like?
No. I think you probably think you do.
Yeah.
And everybody gives you these, here's what basic is going to be like.
Yeah.
And, the best piece of advice I ever got was from my Uncle John Mott, who was in the Army. He went to Vietnam. He just said, you got to remember those drill instructors. They go home and they mow their grass. Oh. They cook dinner. They're just like us.
Yeah.
It's just their job. And there's plenty of times that you're standing there getting yelled at thinking, they're just like me. Yeah. So, but no, you have no idea what you're getting yourself into.
So you grew up in Wisconsin. Yep. In a rural area. What kind of people did you have going to high school with you? What did you expect you were going to encounter when you got into the Army?
Well, when you grow up, mom stayed home, dad went to work. I had 2 younger brothers, lived in a urban area, sort of like Muskegon, Grand Haven, but just 10 minutes out of town, you're into the farms. I was part of Future Farmers of America at school, Wisconsin Junior Dairymen's. So there was a lot of that in my life, hunting and fishing. But I don't know. I don't think you're just not fully prepared for adult life yet. And I think you have to go through some of these decision-making processes, and not to say the military is for everybody, but if you went to college, you'd go through the same thing. You know,
Sure.
You're going to have to learn who you're living with in this dorm.
Yep.
How often does that not go well the first year? But when I went into the military, I think what I have is normal. So that's
Yeah.
what everybody has, right?
Exactly.
And then you get there and realize, well, the guy next to me in the bunk never owned a pair of shoes before. And this one didn't know his mom and dad. He lived with his grandparents. And this one only had a mom. And suddenly you go, man, maybe I wasn't normal.
Yeah.
Because there's so many different normals out there.
Mm-hmm.
And it really taught me how to sort of embrace other people. Because when I got down to it, that was your buddy, and they're going to have your back, you're going to have their back. And it didn't matter that they didn't have shoes before. They only had one parent, or they lived with a grandmother.
Right.
At that point, it didn't matter.
Well, and at the end of the day, you're all on the same team.
Yep. 100%.
So you got to figure it out. You got to figure out how to communicate with people that are coming at every conversation from a totally different perspective. Wow. Well, later we'll talk about how that informed your leadership style today, because I'm sure that it has made a big impact all along the way.
Yeah. Didn't know it was going to, but it certainly did.
Yeah. Yeah. So, while you were in the military, did you have a sense of what happened when you got out?
Not sure the question you're trying to ask.
Yeah, I mean, just did you have a plan? Did you know what you would do? I mean, so the commitment was how long?
2 years. I had to extend a little bit to
Okay.
Go to airborne school, because you had to have a year out after you got out of that training. I didn't have a plan. I knew now I had college money, right?
Yes.
So I knew I was going to go to college. I had the combat medic training so I could work in a hospital, and I worked as an orderly. And I remember going through...
And this was where? Sorry to interrupt you, but
Columbus, Georgia.
Columbus,
That's
Georgia.
where Fort
Okay.
Benning was, where I was stationed.
Okay.
And then worked at the hospital and would go to school at the University of Georgia, Columbus. Walking down the hallway one day, I see this sign that says Medical College of Georgia Physician Assistant School, like applications due by this date. And before the military, I never even heard of a PA before.
Right.
But my troop medical clinic leader was a PA. So I got to know him pretty well, and I thought, that's a pretty cool job.
Was it a relatively new profession in medicine, or just that you hadn't heard of it?
Probably because I hadn't heard of it.
Okay.
It had been out there, certain areas of the country.
Well, I mean,
it was out
until you
there.
became a medic, you didn't think about medicine,
Not at all.
perhaps.
Not
So,
at all,
I mean,
yeah.
if it's not on your radar,
Right.
there's a million careers out there we don't know exist until it's on your radar.
So the PA program came from the military medics. When they got back from Vietnam, they were highly trained, and they didn't really have a spot for them in our healthcare system.
Mm-hmm.
So they created this physician assistant
That's interesting. I didn't know
role. So that's how the PA program started, and that's how I got interested in it. I met this PA. So I'm walking down the hall, I see that, and I think, well, let me see. I looked all the prerequisites I had done. I didn't complete my degree yet, but I had all the prerequisites done. So I thought, I'll apply. And I didn't know it at the time, but the person who ran that program was ex-military, loved military folks who were medics, and he was going to retire the next year, and I think it was his last hurrah to bring in as many of those medics as he could.
Yeah.
So went and interviewed, and the next day, this is before cell phones and pagers, the phone rings on the unit I was working, and they asked for me, and it was the president of the PA program saying, we'd like to offer you a spot. I said, well, can I think about it, get back to you tomorrow? And he said, there are 624 applicants for like 20 positions, and I'm offering you one. So I said, I'll take it.
Yeah.
And next
Good
thing I know,
choice, John.
living in Augusta, Georgia, going to school. So.
Oh, my goodness. Okay. So at that time, I mean, the PA programs have changed over the years, but at that time, you had your prerequisites done. The PA program was going to pick up pretty quickly after you accepted.
I think I got accepted in the spring, started in June.
Okay.
Yeah,
So
it was pretty quick.
Yeah, pretty quick. So you go into that program, and it's another 2 years, or is it a full 4 years after?
It's about 3 years because
Okay.
you go through the summers, and it started right up with gross human anatomy, and you're off and running.
Wow. Wow. And, I mean, did that just feel like you went right in front of the fire hose?
Yeah, but I think if I would have went to school like that out of high school, I don't know that I would have done well. I think the Army did teach you how to understand how to drink from a fire hose, and prioritize, and just set your mind to something and get it done. So I think that really helped me. End up graduating top of my class.
Good for you.
And we were a pretty tight-knit class. But after the first week, that's all you do every day.
Yeah.
Is
just live and breathe
PA
it.
school, yeah. That's just what you do.
So does it, I mean, now that you were in the program and you're recognizing, okay, I've learned how to do this. I've learned the raw materials it's going to take for me to make it through this program. Does it then make sense to you why the director of that program was picking kids that were coming out of military background?
It does now.
Yeah.
Because I think, if you only have a certain number of slots, you don't want people to fail out because that'd look bad on you. Plus, you're wasting that slot for a whole nother year.
So tenacity, for sure.
And
dedication, stick-with-itness, all of those kinds of things. What are the other things that you think someone with a military background, in maybe even a medic position, really set you up to have success in PA school?
I think learning how to prioritize,
Yeah.
and when you've got 100 things going on all at one time, to be able to, in the moment, to stop, quickly assess, and go, I got to do this, then this.
Yeah. Keep your cool.
And know that sometimes there's really not one right answer. There's probably 3 or 4 different right answers or ways to go about something, and it's okay that it's not the way you think it should be done.
Yeah.
And I think the tenacity, just to say, I'm not going to give up.
Yeah.
This isn't going to beat me.
Yeah.
So.
You brought up about how there's many ways to do things. I think that, the perception is that, these young men, at the time, probably mostly young men, right, in the military, they come in with a pretty big ego. And, what you saying, there's a lot of ways to go about this, and I need to listen to everyone's ways. Do you feel like that's something that's always been a part of you, or do you feel like that was learned in this experience in the military?
I think that's learned throughout your whole life.
Yeah, I do
experience that. If you'd have asked me right out of military training, I would have told you exactly how things need to be done, whether that was right or wrong. But yeah, I think as you become more enlightened and sort of figure out that life is a team sport, and you can't do it alone. And once you figure that out, you realize other people have great ideas too, and you just have to listen to be aware of what they are.
Yeah, absolutely. Yeah. So, so you go through PA school, 3-year program. The director of the program is looking to retire. What does that mean for you and your career trajectory coming out of PA school?
So they replaced that person before I even got there to start the program.
Did they?
Yep.
Okay, so it wasn't the same guy that got you interested that saw you through the program.
Nope. So all new. Bonnie dated another PA from Colorado. Fantastic.
So he got his people in.
Yep.
And then
he was out.
And he was out. All right. So, okay. So you go through PA school. Do you have a sense of what you want to do after PA school? Do you think PA school sets you up to understanding how you might fit into modern healthcare at that time?
It did. I think, for the 2.5 years, you're just constantly studying and going on rotations. You realize you've learned enough to pass an exam, but now to start practicing medicine, completely different, right? And the rotations really kind of highlight that.
Yeah.
So I think you're ready to start to learn how to do this. You have the basics, but not really, you have no full understanding of what this is going to be like to do this full time.
Yeah.
And when I got out, I decided I was going to stay at the Medical College of Georgia. I got a job with the infectious disease section, working in an HIV clinic, and this was back during the Ryan White days where, to get AZT was $10,000 a month.
Right.
And if someone
people were
passed
dying.
away, you would take their medicine and give it to somebody else,
Yeah.
which probably wasn't the way we were supposed to do it, but that's how things were happening
Right.
back then. A lot of study drugs. And so I learned a ton about, the empathy side of being a PA, being in healthcare, because no one lived. It wasn't like it is today where we kind of figured out you can live
Yeah.
with HIV. Back then it was a death sentence, and it wasn't that long. And you could watch them sort of every time they came into the clinic, it'd get a little worse. And then I was working on a PhD for endocrinology physiology, and got to the point where I had to decide to go do just that in all of my research. And I started looking around at the different PhDs that were running the programs, and every year they would struggle to I have to get this many papers published, I got to get this grant secured. And teaching was like almost on the side. It wasn't what they had to do.
Yeah.
And I just didn't think that was for me. I didn't want that drive every year to be about getting a grant, or, if I could just teach, be different. But that was not the case back then. So I started looking around, and I looked at a map, knowing I was from Wisconsin, and here's Michigan, here's Muskegon on the water, and I just said, I want to go there. And at the time, there were 5 or 6 PA positions for every PA, so you could get a job anywhere.
Wow.
And within a couple of weeks, I had interviews, and I was 1994 living in Muskegon, Michigan, working at Mercy Health at the time.
Yeah. Yeah. And we talked before we got on air. It's a pretty great place to live. We live where people are on vacation.
It's amazing.
Yeah. Yeah.
For sure.
So, hospitals, healthcare systems have changed a lot since 1994. But you started as a PA, and how tell me about how that differed from what you expected or what you encountered in those first couple of years.
So, at the Medical College of Georgia, they train PAs. They're in all the rotations throughout the hospitals. People know what a PA is. When I came to Mercy Health in Muskegon at that time, there was one other PA that worked with cardiothoracic surgery, and he was either in the OR or in the ICU. You never saw him on the floors. So no one knew what a PA was or what they did. So I'd come on the floor, and the nurses look at me like, what are you going to do? And the other specialists and docs look at me, what are you here to do? And in my head, I'm like, I have no idea what I'm here to do, but we're going to figure this out.
Yeah.
And luckily, and we talked about this before, Dr. Hissam, he had the vision to understand medicine had to change. And family doctors in the office weren't going to be able to do hospital medicine at the same time. We all, when we grew up, were waiting in a doctor's office, knowing that they had an emergency, they had to go admit someone at the hospital, and they're pushing their office behind. He figured out that if someone stayed in the hospital and just did that, 1, they'd become really good at it. 2, they would know where all the white spaces are.
Yes.
How do I get a CAT scan a little sooner? Go talk to this radiologist for the result. Get the lab,
Right.
done.
Creating efficiencies that you can't see if you're not there every day.
And that's what you do versus I got to divide my attention between 3 different things.
Yeah.
Nursing home, office, and then the hospital. So he literally started the Hospitalist Movement back in 1994, and there was no such thing before then.
And you were a part of that. That was groundbreaking at the time. Did you even realize that it was?
No. I knew it was a great idea. I knew if I was going to do anything new like this, it would be with someone like him. But I didn't realize how it was. This is everywhere now. That's a standard for a health system, is to have a hospitalist group, right? And to go from Dr. Hissam and myself, and then we added Dr. Nagelkirk, but now there's 25 or 26 docs, 25 or 26 PAs running, 3 hospitals, Shelby, Muskegon, and Grand Haven for Trinity Health, down the lakeshore, 24/7, 365. That's just, and to start with 2 people there. Crazy.
Yeah, it is crazy. And so how do you think that methodology, spread throughout today's healthcare from little Muskegon, Michigan? I mean, obviously the word got out that you were making it work and that it was successful. Does that happen because of Mercy's connection to other hospitals? Does it at the time?
Yes.
There was no internet.
There
A
was.
little
it
bit,
wasn't,
I guess.
It wasn't
but
like it is
not
today.
today's internet.
So I know that Dr. Hissam got together with other internal medicine docs that thought similarly
Okay.
about this idea and started the Society of Hospital Medicine, SHM, that, he wasn't the only one thinking this. I think there was other people thinking this. And the health system, we always are in constant change. And it's not like we're getting paid more and more every year. We get paid less and less every year.
Mm-hmm.
So you have to become more and more efficient. And this was just one of those, sort of like Ford Motors going to the assembly line.
Sure.
This was a change that big for health systems. And sort of to lead that or be one of the first that really figured out how to do this right, that was amazing. And most hospitalist groups will last 5, 6, maybe 10 years. And it's the same hospitalist group from 1994 till now. That's the only hospitalist group that's been along the lakeshore.
Really?
Which is pretty crazy to think about.
Pretty crazy. Yeah. It just shows that, teamwork and the right structure makes good sense and it makes people happy.
And it wasn't about ego.
Yeah.
A lot of...
Well, and so the outside doctors had to embrace it too, because now these patients aren't theirs anymore. They might they're going to see them follow up in their office, but they're not coming and doing rounds at the hospital anymore,
what is this PA
right?
gonna do with my patient?
Right. So you're taking that position for their entire stay at the hospital. What's the good thing about that? And what's the, I can see lots of good things because we've now, all of us have experienced it, right? And that you're not waiting on that doctor to finish up his in practice visits to come and see you at the hospital because the doctor who's seeing you is there. But what were you fighting against, or were you fighting against the opinions of the doctors that now weren't coming and rounding at the hospital? What were they, worried about?
Loss of control, right? Anytime you change something, everybody says, the people push back from change. And I don't think it's the change that bothers them. It's they're losing something. Mm-hmm. And they're losing control of that patient. So you have to trust the system to return that patient to your office in better shape than what that person came to the hospital in. Are they going to do things the same way you would want them done? That patient went on vacation, who their kids are, who their father. Everything as a primary care doc about that individual, and suddenly I don't know those things. And how much does that play a role? So I think there was a lot of concern. But what happened was you had one or two early adopters in the offices, and then you'd have these ones that say, well, I don't have coverage this weekend. Could you just cover me for the weekend? And then everything would go okay for the weekend, and then it'd be like, when I'm on vacation, can you cover me? Which is difficult to staff when suddenly you have 4 or 5 practices when you're really only supposed to have 2. But there's one thing that Dr. Hissam and the group was good about was just, we'll take care of it, do what's best for the patient. So you slowly win that battle as you show them that we're okay.
Yeah.
The other thing was there wasn't a lot of PAs in town, and you've got nurses that are wondering what you do, and you have a lot of doctors going, how does this impact me now?
Yes.
And I can tell you, our medical staff, Grand Haven, Muskegon, Shelby, we are lucky to have the docs we have. They're amazing. And I will put them up against the Mayo Clinic, Cleveland Clinic. They're literally top notch. And when they're that smart, that bright, they see it. They catch on pretty quick. And now you see, OAM, the orthopedic group, they have their PAs, and the general surgery group has their PAs, and vascular has their PAs. They figured out it was a tool that could help the health system and help the patients and help them. And it wasn't something that they should be fearful of. And not all places were like that. So to have a medical group that is so open-minded, could see the future, and I think Dr. Hissam driving it and making sure that we're held to a high level of accountability as PAs with that group really set things off and set up Muskegon in this whole lakeshore area to have PAs from here on out.
Well, and certainly must have taught you lessons about how to address, challenges and resistance, what are some of the things that you learned in trying to create that adoption and get people to welcome that approach?
I would say communication. You can't over-communicate, and sort of putting the feelers out when you're going to get another office that's going to come and give you their patients. Dr. Hissen would talk about that a month or two in advance, just to get people starting to chatter about it. What do you think we should do? How should we handle this? It gives people a chance to buy into the change,
prepare,
have a little bit of
emotionally.
say in how we're going to do things. So I think communication and
I think that's a huge leadership lesson, right? Is just to get out ahead of things as much as you can. I mean, we all are drinking from a fire hose to some degree, but as leaders, we do see things coming sooner than others. And if you can just open that door to everyone, it helps everyone be better adopters of change.
And I think relationships, building relationships on integrity, tell you, if Dr. Hissen says it's going to be this, he believes it's going to be that. He would never mislead. And I think having the ability to, whether you're delivering good news or bad news, if they know what John says is what it is, that is so important. You can't put a price on that.
Right. When you think back to that time and, having the new hospitalist program and, you were fresh out of not so much school, but really a totally different environment, right? Coming into that, did you tap back into those lessons you learned in the military that taught you about teamwork and dedication and things like that helped you to lead?
I would say yes. You go back to all the things you've learned, right? And that was obviously a big influence in who I became, whether it's as a leader, as a parent, husband. That forms you, right? It's one of those formative moments in your life when you go through something like that. I also, there's some bad habits that can come from the military. So if you're aggressive, if someone ever questioned you and you outranked them, that just didn't happen. But that's not reality.
Right.
So you have to understand there's a difference between civilian life and that. So for me to say, we're just going to do this, that's not as taken as well as
my way or the highway doesn't work.
Here's our problem.
Yes.
Here's what we have to get done. What do you guys think we should do? I think that's a different conversation. And ultimately,
something you had to learn how to do.
And control. And there's times, when it's the Joint Commission or CMS who make sure we're following regulations, that is one of those, this is what we're going to do because this is the rule. So you can pull that out and say, oh, this is just to do it. Mom and dad say be home by 10:30. You're home at 10:30. You don't really ask why. You can, doesn't change 10:30.
No, so. No, that's true. So, so you worked as a PA in the hospitalist program, and at that time, did Grand Haven and Shelby exist? Was it just Muskegon?
So you had Mercy Hospital in Muskegon. You had Hackley Hospital.
Oh, correct. That's right.
And then you had General Hospital, which was the osteopathic hospital. Shortly after I got here, General and Mercy came together.
Okay.
Mercy General Health Partners.
Hackley was a late addition to the...
And then ultimately, they became, so General closed down, came over to Mercy. Then we had the two hospitals, and then they slowly became one. Hackley aligned with Shelby in the 90s.
Okay.
And then that came under the Trinity Health umbrella.
Right.
And then 4 years ago or so, Trinity Health and North Ottawa came together. Now it's Trinity Health Grand Haven.
Right.
A lot of change.
A lot of change. So navigating through that change, certainly a challenge in your role, but your role didn't stay that role through that change. You changed roles as well. So somewhere along the line, someone said, this John Foss man is a leader, and we're going to do something with those skills. How did that come about?
And so I'd mentioned there was not a lot of PAs in Muskegon. And at that time, the strategy of a lot of hospitals were to start a medical group. And they would own primary care offices because that's the patient base, and then you'd get the referrals from them. So they started putting together different private practices, employing them, and they had Tom Reynolds, one of the first people that I really got to know in administration. I think maybe he saw something in me that said, you know what, this is someone we got to move up the ranks here and utilize him a little differently than what we're utilizing him now as. I would help him with the PAs and the nurse practitioners contracting and,
And you're still a PA. I mean, you're still every day on the floor seeing patients.
Not every day, but I do weekends. I would love to do more.
No, I mean, I don't mean today. We'll come back to that. I meant at that time.
Yes.
You were still working full-time as a PA and then doing contracts and things like that, starting to
learn a little bit about the administrative side
Yeah.
of the hospital system. And then I started overseeing specialty practices, so like cardiology group, GI group, OBGYN, and learned a lot about how they functioned, standard work. And, every office has to have its own culture. And I think that's why patients pick a certain office, because it has a feel. So you got to keep that while gaining the efficiencies of being a big health system, whether it be the same EHR, same supply chain, same scheduling template. There's some things that, have to be the same 80-20% rule, right? So learning about that. And I remember going into meetings and they would have a meeting and I'd walk out and I'd say, Tom, what were they talking about? And then he would tell me, well, this is what they're talking about. So he'd take the business language and put it down to just like regular language.
Yeah.
I'm like, oh, that makes sense. So it hit me that, man, I should probably get a business degree. I had to learn, the medical language, right?
Yeah.
So if I didn't know that, I would have a tough time being a PA. So I thought I better work on my MBA because I'm going to have a tough time if I can't speak their language. So I ended up doing that. And then as that's all going on, we're spreading our hospitalist group to Shelby. And I met Jay Bryan, who was the president of Shelby at the time. He's going to retire. And I had a conversation with Tom Reynolds. And he's like, I think you have what it takes to do that. And I applied and
I don't know where all the time must come from, John. Do you have some sort of special clock that you get 24 hours out of every 12 hours? Yeah, right.
No, I wish I did.
Oh God, it's just amazing. The more people that I talk to on the show, and the more that you meet people in leadership roles, and you just begin to recognize that those that do more.
Yeah, it just becomes normal.
Yes,
I think that's just what you do.
Yeah, you wouldn't imagine it any other way.
Yeah.
Goodness sakes. So you began running the Shelby,
the critical access hospital with 4 rural health clinics associated with it. Got that role, and that was my first time where you're running everything.
Yeah.
So radiology has a problem, you're helping that. Facilities and EVS, you're helping with that. Food nutritional services.
Yeah.
So it was eye-opening to see, even a small hospital, 24 beds with an ER and an OR, man, there's a lot of moving parts.
Sure.
I think it helped to be a PA because I knew how a patient would flow through those areas. So if I changed something in radiology, I know that would impact other areas, and then how would that impact them? So I think that helped us there. And since then, we, like any other organization, you check net promoter scores. And we just got an award in Shelby in the top 15% for patient experience.
Second time.
Yep, top 100 hospital.
Top 100 hospitals.
For critical access. That's puts you in the top 7% in the country.
That's a big deal.
So that's all about the team, right?
Yeah.
And I think that's where the military really taught me the importance of not about you, it's about them, and it's an us issue.
Yeah.
So getting a team to buy into something and watching that happen, and then sort of being self-perpetuating where they just do it because that's what they do every day, is so fun.
So you told me a story about a moment where you overheard someone talking to another teammate. Can you tell us about that?
Yeah. So walking down the hallway, and I when I'm at Shelby, I try to go in and see every patient, during the day, and just thank them for staying there. Is there anything I can do to make it better? And we had a new hire who was in with a patient, had a conversation, and when she came out of that room, the person that was training her said that's not how we do things here, and said this is how we do things at Shelby. And if you can do that, you've won, because they're taking care of themselves at that point.
Mm-hmm. Absolutely.
Yeah.
Absolutely. So, so how have things? So what's the next step? You have Shelby. Are you still? Are you? I mean, you're
Still
working as a PA on occasion,
yep.
picking up shifts.
And then we had a redesign or restructuring in Muskegon that ended up with me being over the EMS service, the security, supply chain, neurosciences, and plant ops facilities. So I started taking that on, and then it wasn't maybe a year later, and they started talking about the Grand Haven's going to come to fruition. Would you consider, leading down there? And sure, why not?
Yeah, why not? Add it to the list.
Having worked there as a hospitalist, the team, which is one of the hardest things to create, is that culture. That was already there. Man, that is amazing, the culture in Grand Haven.
Yeah.
This is just going to be reimagining what we need to be.
Right.
Because, a small community hospital, that just isn't a thing anymore. Very hard to when you've got other hospitals so close. So what does Grand Haven become? And that's what we're working on now.
Yeah.
But the team, amazing. So whatever we become, it's going to be the best of that, whatever that is.
Yeah,
that's what
great.
We're doing now.
That's great. So let's talk a bit about how just healthcare has changed. Insurance coverage has changed. How hospitals get paid has changed. As a leader of a healthcare system, how does that impact the decisions that you have to make?
Yeah. So I think it's true of any business. You want to be as efficient as possible. What you're doing now, you believe is the right thing to do, or you wouldn't be doing it.
Right.
So to challenge that is always tough, because what we're doing is the right thing. And it may be the right thing, but is it the best possible right thing? That's what we have to ask ourselves. And how will we do it differently? And, every year you get paid a little less and things cost a little more. So you try to gain some efficiencies and make it, can you see one more patient? But you can only do so much of that. And now with like the big, beautiful bill, a lot of good things with it, a lot of not so good things with it. One of the things it is impacting is sort of our payment to the health system. So Trinity, nationwide, you're looking at $1.5 billion in less reimbursement. That's a lot to overcome.
That's a lot, yeah.
You're not going to do that seeing one more patient. You're not going to do that, having a decrease in FTEs. That's just not going to be the way to do it. So you have to rethink, how do I deliver care?
Yeah.
And then how do I do it regionally? Not just the best in Muskegon, not just the best in Grand Haven, but how about West Michigan, or how about all of Michigan? Is there ways to work together to make this better? And I think you have to lean on frontline staff who do this work every day. They know the answers. They know where these efficiencies are. They know if
They
I
might
just
never have been asked.
Today I
you
had
might
my all
ask,
staff meeting.
but I'm just saying, like,
that. Yep.
that's it. I think that happens in business today. Is that they probably do know the answers, but they may never have been asked.
But that's where we're going to have to go to get these efficiencies to make up that kind of deficit. It's.
Well, I think that they say you can't cut yourself. You can't cut your way to prosperity.
That's certainly true. Well, and the other thing, and I don't think everybody realizes this. So if you're a business and you're going to get cut $1.5 billion, people would say, well, all right, we'll just make less widgets. We could, but the problem is people, if they don't have health insurance now because Medicaid got cut, they're still going to get sick. They're still going to come in, and they still need to be taken care of. So we can't stop making widgets. We got to take care of everybody.
Yeah.
we're just going to have to do it for free because they don't have coverage. And they certainly aren't going to have the money to pay for their bill either. So it would be easy to say, well, we'll just build less things, but that's just not the business we're in. So all that is still there. We're just going to have to do it with less resources. And then how do we do that?
And that takes teamwork.
That takes everybody to figure that out.
That takes everybody. Wow. So you talked about big things coming up in Grand Haven. How is that change, coming together? What can we see in the future happening in Grand Haven? What can you talk about?
Yeah, so first thing is we noticed we did not have any outpatient presence for physical therapy, occupational therapy, speech therapy below the drawbridge. And that seems to be a barrier for some folks.
Yeah, it's crazy.
Although Costco, they seem to get there. So we're going to open up an outpatient clinic just down the road from the hospital on the main drag there in Grand Haven. So that's going to be exciting. It'll give people an option more than what they've had before. It'll have our same electronic health record that we have. So your visit will be immediately known to you and to your primary care doc. We just opened up our first general surgery office that's within our medical group. Dr. Zwemmer and Dr. Horton, two amazing surgeons that are employed, and they work exclusively in Grand Haven, and that's going really well. We have a huge primary care presence on the third floor of our medical office building, and now we're trying to get more specialty practices down there. So, all the outpatient things you're going to be able to get done at Grand Haven, no problem. So you think about 90% of your care can be done in Grand Haven. It's a 10% that we're going to have to figure out where's the best place for you to go.
Sure.
And then you can come back, if you're that ill or need that specialty care, then you can come back and get the rest of your 90% in Grand Haven. The one thing that we're really looking to do is become, when someone's having a conversation and they say, I had this problem, and they're going to say, well, you're going to Grand Haven for that, right? Because that's what we're going to be known for. So that's what we're working on right now. And I can't wait to be able to talk about it. We're almost there, but it's going to be pretty cool.
So right now, though, you have Muskegon, Shelby, and Grand Haven. The same doctors are serving all of those markets.
Same emergency medicine group.
Same emergency medicine
Same
group.
hospitalist group.
Okay.
Surgeons are a little different, but like the specialist, the same GI group that sees you in Muskegon, they'll do colonoscopies and EGDs in Grand Haven. Cardiology has a presence down there. So it's one big medical group.
Yeah.
Yep.
Yeah. So it's the healthcare you can trust, but right outside your front door.
Yep.
So choose where, choose your own adventure, right?
And choose Grand Haven.
Yeah. Yeah. Well, we're lucky to have that right here. How has Corewell coming into the market impacted the decisions, changes that you see Trinity making?
Yeah. I don't know that. So any competition makes you do something different, right?
I think probably makes you better too, right?
I look at that as people are going to choose where their experience is the best. Because if you get admitted to a hospital, you expect to be treated well medically because it's a hospital.
Yeah.
It's going to be the other things that create that experience that you're like, that's where I want to go. Shelby, when I first got there, I would go to the Brown Bear and have lunch, and you would hear people talk about I wouldn't take my dog to that place. And I felt so horrible that was their perception because I knew how great the care was there.
Yeah.
I knew the providers and the nurses, the staff, how caring they were. They live in that community. They're proud of that. You don't hear that anymore. And you don't get to be top 100. You don't get to be top 15% for
don't.
Net Promoter Score by not providing that care. So our thought there was you just prove it. Prove one at a time when they come in, this is the place to be. And that's how we're going to do it in Grand Haven. And I think that's how you do business in general.
Yeah.
The best possible experience, they're going to come back.
Yeah, absolutely. So when you look back to high school and making the decision to, and I I gave you all sorts of props in our previous conversation about just frankly having the courage to walk into the Army recruiter's office, I think is a really big deal and says a lot about, just you as an individual. But if you go back and you were to have a chance to talk to that kid, what are the things that you would say to that boy about, pay attention when this happens in your life. It's gonna make a difference, and you're gonna have a chance to change the trajectory of your life.
I tell them to slow down.
Yeah.
There's no hurry. But you don't know that till you're older. Right?
No, you really don't. It's really good advice.
Slow down, and I don't think it was that hard to go through basic and, AIT, where you learn to be a medic, or airborne school. And I think it was more normal back then, because we'd have a list of people who were going to college, going in the military. And I was at one of my younger sons plays football for Mona Shores, and we're at one of their practices, and they have a board in the high school that has all the people who went in the military. And you look at the last 10 years, there's not a lot of people that have gone in the military, and that's kind of sad. But I would say to anybody that if you're not ready, you don't know what you're going to do, there are worse things that you could do than join the military. The things that you learn from their life skills, amazing. You're not going to learn anywhere else.
Right. Well, you've talked about a lot of lessons that you learned along the way, that or built on those lessons. And, I think that it's pretty incredible. And the path that you took, we talk about the career pathing that, that a lot of young individuals want. And if anyone had set a path out for you, it wouldn't look like what it ultimately ended up being. Somewhere you found the gaps and made a pivot here and there.
Yeah, I don't know that I could have recreated it if I had to.
But you were open to it.
Yeah,
you were willing to take the leap when someone said, "I believe in you."
And for the most part, the easy path is not the one to take. I think if I had 4 choices, I tend to lean to the hardest choice. I don't know why. I don't know if it was a good thing or a bad thing, but however it happened, it led me here.
Yeah. Up for the challenge.
And maybe it's because less people do that. I don't know. But when you're faced with a decision, that's one of the things I put in there. Which is the easy path?
Yeah.
What would everybody else do? And then why wouldn't I want to be different and figure that out?
Yeah. And what does that message look like when you're talking to your team?
For my team, I think it is, if you're in healthcare, all you want to do is help people.
Mm-hmm.
And that's true whether you're in healthcare and you're in plant ops. They want to make sure that the temperature's right, the humidity's right in the ORs, the air pressure's right, because they care about no infections and the outcomes of those patients. Now, nurses, obviously docs, they're hands-on with those people. But everybody in that hospital and those clinics, they're there to make a difference in someone's life. For them, I just tell you, you do you. And as long as you make decisions that you said, if it was my mom or dad,
mm-hmm.
that's what I'd want done, we'll have your back. We'll be fine.
Yeah.
And it's worked at places I've been so far. Nothing makes me happier now than to see somebody succeed or do something they never thought they could do, and then they do it.
Yeah.
That's like the payoff now.
So to me, that's one of the greatest attributes of a good leader is just being able to champion those around you, to be able to just really, truly be able to celebrate everyone's success. That's certainly very clearly the leader you are. It's fun to listen to. So before we finish up, I want to talk about how philanthropy plays a role in today's healthcare systems. We talked about just how you're having to do more with less. Let's talk a bit about how every dollar makes a difference.
Yeah. One of the big things, Shelby, for example, I don't like to use philanthropy for just day-to-day stuff, but there are some things that would change how a nurse functions every day, make it less stressful on them physically, better for patients. But some of these options, like one of them is called Hercules, where you can actually lift a patient in bed and they just push a button and it sort of rolls them up. There's like a sheet that's 9 sheets long and it's underneath the head of the bed. It's a pretty cool item that now instead of 2 people lifting someone who's heavy and hurting their back, they hit a button and it pulls them up. Decreases pressure ulcers, decreases skin tears, decreases wear and tear on the nurses and the aides' bodies. But they're $6,000 a piece, and you don't need them. But those are the things that, with philanthropy, we can make huge differences. And there's some people who have, it's in their blood to give and give and give, and they have a lot of resources. And sometimes, I don't want to say normal people, but the average person wants to give, but thinks, my gift isn't going to make a difference. $10 makes a difference. It really does, because it's matched with someone else's $10 and someone else's $10. And it can change, the care for someone in a hospital. We've got a lot of new heart equipment in Muskegon that was donated. Now, that's a big ask, but that changes people's lives every single day. So I guess for philanthropy, what I'd say is it is something inside that person who wants to give. And if you haven't, it's an amazing feeling to know you've done something like that. And it isn't about the amount. It's about just doing it.
Yeah.
So if it's $10, it's $10. You're part of the change, and you're part of making things better. So, and I'm on that council as well, that committee for philanthropy. So anybody out there who wants to talk about it, please give me a call.
Yeah.
We'll have a conversation.
Well, I think it's a really good message just to say out loud that every little bit counts, and that it doesn't have to be tens of thousands, hundreds of thousands of dollars. That it all helps and makes a difference in patient care. Yeah, that's a big deal. So, certainly you have had a lot of great individuals, mentors in your life, or individuals that help to push you in new directions. Have you had the opportunity to do that for others, and how did that make you feel?
I have. So Trinity has a mentor-mentee program. I've been part of that for the last 3 years. And just helping someone that I never met. The one I have now is from Chicago, and she...
And what's her role within the system?
She's a office manager.
Okay.
And looking to move up, become a little bigger part of leadership, and just helping them navigate the day-to-day. We'll have a list. What would you do in this situation? Well, I've had that situation. Here's how I did it. Don't do it that way, because here's what I learned. But having those conversations, there's a lot of PAs that I've worked with over the years, nurse practitioners, that you can kind of see them now starting to grow into different leadership roles, and that's fun to watch.
Yeah.
The fact that Trinity Health, so the president, Gary Allure, one of the best people I've ever worked for. What you want in a leader is someone who's consistent, doesn't get frazzled. The world could be falling down, and they're like, all right, here's what we got to do, and they just go through. Yeah. He's amazing. The chance he gave me to lead Shelby and then on to Grand Haven, I like to see that in other people.
Yeah.
Give them the chance, help them through, and maybe not show them exactly the path, because I don't know all the answers, but to say, if you did this, maybe you could get this, and that's fun to watch. Other people's success is way better than mine.
Well, and you've talked about how I can't remember how you said it. You'll be able to jump in here, but that there's never a day that you're the most important.
Yeah, that's true. At the hospital, and I at all staff meetings, we talk about there's going to be a day that you're going to be the most important person in this hospital. I have yet to have that be my day. Like, no one comes in and thinking that the vice president of the hospital is going to be the most important person, because we're just not. But that EVS worker who cleaned the room really well before that fresh surgical came into that room so they didn't get an infection, the person who's making the food for that person to get better, that nurse or that doctor who's responding to a code blue, they're the most important people. The plumbing gets backed up, your facilities plant ops people, most important people that day. So you got to be ready at any time to be the most important person, and that can happen to anyone in this room.
It's a really cool
and it's just
message.
not going to be me.
Yeah.
It just hasn't yet.
There might be a day. There probably
when
has,
I'm a PA
there
on the
probably
weekends.
has been days, plenty of days, where you were the most important person that day. You are today, right here.
Right. For this moment.
Right here
I'll
for
give you
this
that.
moment, you are. But, I think that it's a really good message in whatever profession you're in, that you have to be ready.
Yep.
Ready to be called upon, ready to have it be your day
To step
to
up.
shine. Yep.
For sure.
Yeah, well, that's cool. Well, I have really loved talking to you, John, and learning more about you and all that you've got going on. Is there anything that we didn't touch on that you want to make sure that listeners hear about?
No, just, I guess, shout out to my kids, Johnny, Conrad,
nice.
Colton, and Gentry.
Well, you know what? You clearly are setting a good example, and not only to your family, but your teammates. And it sure is fun to talk to people who, take those sort of unpredictable paths to leadership and all the lessons they've learned along the way. Really, thank you for joining me today.
Thank you.
Yeah.
Appreciate it.
Thanks for listening to Inspire West Michigan. If you enjoyed today's episode, be sure to follow or subscribe wherever you listen to podcasts, and leave us a review to help others find our show. Visit inspirewestmichigan.com and follow us on social media for more behind-the-scenes stories. Until next time, stay inspired, West Michigan.